we are covering the critical differences between cleaning, disinfection, and sterilization for your phlebotomy certification exam. These concepts are fundamental to infection control and are guaranteed to appear on your test in scenario-based questions. The exam will test your ability to choose the correct level of decontamination for a given situation. Let's start with the absolute first step in any decontamination process: cleaning. Cleaning is the physical removal of visible dirt, organic matter, and debris from a surface or object. Think of it as using soap and water to scrub a surface. On the exam, if you are ever asked for the first step in reprocessing a contaminated item, the answer is always cleaning. You must clean an object before you can effectively disinfect or sterilize it. An exam trap might present a scenario with a blood spill and ask for the immediate action. While disinfection is necessary, the very first physical step is to remove the visible contamination. Next is disinfection, which eliminates most pathogenic microorganisms, but not necessarily all microbial forms, especially bacterial spores. The exam will expect you to know that disinfectants are used on inanimate objects and surfaces, not on living tissue. For example, a blood pressure cuff or the arm of a phlebotomy chair that touches intact skin would require low to intermediate level disinfection. You must also be familiar with the term contact time or dwell time. This is the amount of time a disinfectant must remain wet on a surface to be effective. A common exam question might describe a phlebotomist spraying and immediately wiping a disinfectant. This is an incorrect procedure, as the required contact time was not met. For blood spills, the standard is an EPA-registered disinfectant, with a 1 to 10 dilution of household bleach being a classic example you must know. The highest level of microbial destruction is sterilization. This process destroys all forms of microbial life, including bacteria, viruses, fungi, and most importantly for the exam, bacterial spores. The key differentiator between high-level disinfection and sterilization is the elimination of spores. Your exam will link sterilization to critical items that enter sterile tissue, like surgical instruments. The most common method of sterilization you'll be tested on is the autoclave, which uses pressurized steam at high temperatures. A question might ask for the appropriate method to prepare reusable instruments that have been exposed to blood. The only correct answer is sterilization. A major confusion point for test takers is the difference between a disinfectant and an antiseptic. Remember, disinfectants are for non-living surfaces. Antiseptics, like the 70% isopropyl alcohol used to white a patient's arm, are used on living skin to reduce the number of microorganisms. The exam loves to trick you with this distinction. To help you remember the hierarchy, use this phrase: cleaning defeats spores. Cleaning is first. Defeats stands for disinfection, which kills most germs. Spores stands for sterilization, which kills everything, including spores. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.